Imagine waking up with a simple cough. You feel weak. You develop a fever. Your chest starts hurting. At first, it seems like an ordinary illness. But within days, breathing becomes harder. Your lungs begin filling with fluid. And suddenly, something as basic as taking a breath becomes a struggle. For centuries, doctors had almost nothing they could do. Pneumonia wasn't just an infection. It was a terrifying race against time. And the most shocking part? People could die from it before doctors even understood what was happening inside their lungs. Pneumonia is not a modern disease. Long before antibiotics, vaccines, or modern hospitals, people were already suffering from severe lung infections. Ancient physicians described patients with fever, chest pain, coughing, and extreme difficulty breathing. But they didn't know about bacteria or viruses. They couldn't see the enemy. All they could see was a person struggling for every breath. And because there were no effective antibiotics, even a previously healthy person could suddenly become critically ill. So what happens inside the body? Pneumonia occurs when an infection reaches the lungs. Normally, tiny air sacs called alveoli fill with air, allowing oxygen to move into the bloodstream. But during pneumonia, those air sacs can become inflamed and filled with fluid or other material. Now, imagine trying to breathe through lungs that aren't working normally. Oxygen exchange becomes more difficult. The patient may develop fever, coughing, chest pain, rapid breathing, weakness, and shortness of breath. And in severe cases, the infection can spread beyond the lungs and trigger life-threatening complications. The frightening thing is that the disease can begin with symptoms that seem surprisingly ordinary. For centuries, doctors blamed pneumonia on mysterious conditions inside the body. Then medicine entered a revolutionary period. Scientists began discovering that microscopic organisms could cause disease. Under the microscope, researchers could finally investigate bacteria responsible for serious infections. One important culprit was Streptococcus pneumoniae, a bacterium capable of causing pneumonia and other serious infections. Suddenly, pneumonia was no longer an invisible mystery. There was an identifiable biological enemy. But knowing the enemy wasn't enough. Doctors still needed a weapon.
Then came one of the biggest revolutions in medical history: antibiotics. When effective antibacterial drugs became available, bacterial pneumonia could finally be treated in ways doctors of earlier centuries could only dream about. A disease that once carried enormous danger could now often be managed with modern medical care. But pneumonia wasn't defeated, because pneumonia isn't caused by just one organism. Bacteria, viruses, fungi, and other causes can all lead to pneumonia. That means treatment depends on what is actually causing the infection. And this is where modern medicine changed the game again. Doctors gained access to chest imaging, laboratory testing, oxygen therapy, intensive care, antibiotics for bacterial infections, and vaccines that can prevent some important causes of pneumonia. Today, pneumonia may sound like an ordinary medical diagnosis, but globally, it remains a major cause of serious illness and death, particularly among young children, older adults, and people with certain underlying health risks. And history has shown us something important. Pneumonia doesn't always need to announce itself dramatically. Sometimes it begins with a cough, then comes fever, then weakness, then breathing becomes difficult. And what looked like a minor illness can become a medical emergency. That's why recognizing serious symptoms and seeking medical care when needed can matter enormously. For centuries, pneumonia was one of humanity's most frightening enemies. Doctors could watch patients struggle to breathe, but couldn't stop the infection. Then science gave us microscopes. Medicine identified the pathogens. Antibiotics gave doctors a weapon. Vaccines added another layer of protection. And modern critical care gave severely ill patients a better chance of survival. But pneumonia remains a reminder of something powerful. Sometimes the deadliest enemies are the ones we cannot see. And even after centuries of medical progress, every breath still matters. This video is for educational purposes and does not replace professional medical advice.